The health industry is booming. With the obesity rate increasing more and more every year, there is something that must be done. You cannot blame anyone else but yourself when it comes to this issue. Some people try to take the short way out by having major surgeries, participating in fad diets, and so on. But only you can change this. Resistance training is the answer. Resistance training helps you with your overall health, including the loss of body fat. It helps you gain a toned body. You will also get a lightning speed metabolism, as well as helping diminish the chances of getting heart disease. It will help you aid and recover from a stroke, protect fragile bones, and it will also help you prevent diabetes. Some people may ask, what is resistance training? Resistance training is any exercise that causes the muscles to contract against an external resistance, such as weights or bands. Resistance will increase your strength, tone, and endurance. There is a lot of positive effects of resistance training. First, it prevents the loss of muscle, otherwise called as scarpinina. Studies show that from the age around 35 and up, muscle is progressively lost from the body, unless there is an effort to slow the progression of the loss. Resistance training will aid in preventing muscle loss. Resistance training is beneficial in so many ways. Training will reduce your risk to develop cardiovascular disease. From the effects of resistance training, it will reduce your blood pressure, which will then increase your HDL. Your HDL is your good cholesterol. It'll reduce your blood glucose and insulin levels. If you have a stroke, physical therapists and doctors highly recommend that you practice progressive resistance training. Progressive resistance training is a safe and effective way to improve your overall health, strength, and mobility after you suffer from a stroke. Another reason why people should incorporate resistance training into their daily regimen is because it will help you with your overall endurance or aerobic activities. Some examples of this would be taking a brisk walk or swimming. This will increase your breathing and heart rate to improve the health of your heart, lungs, as well as your circulatory system. As a result, this will help you with the basic activities of your everyday life, such as vacuuming, running, playing with your children, and so on. Strength exercises such as weightlifting or using resistance bands will increase your muscle strength and aid in preventing injury. Decreases in muscle mass and subsequent reductions in muscle strength, such as one ages, not only results in a loss of functional ability, but it also increases the risk for all falls, fractures. Resistance training programs for an aging population have the same benefits for an increase in both strength and muscle, such as programs do for the younger and more active population. As functional ability is maintained or improved, the risk for injury is significantly reduced. Resistance training will also has an important role in reducing the risk of musculoskeletal injuries related to muscle imbalance. Expressed as either an agonist or an antagonist ratio. For example, your knee flexors or your knee extenders, as a bilateral comparison, such as your right and your left knee flexors. Correction of the existing imbalance through a resistance training program is important to reducing the individual's risk for muscle injury. Some people ask, how much training should I do? Most people think that they need to train between 6 and 7 days per week. This is incorrect. In fact, when you work out that many days a week, or that many days in a row, it increases your chances of getting hurt. Overtraining has an adverse effect to your body. According to the American College of Sports Medicine, they recommend that beginners do one set of 8 to 10 exercises for major muscle groups, 8 to 12 reps each, or until failure. They suggest that you do strength training an average of 2 to 3 days per week. For older people 50 and above, they suggest that you do 10 to 15 reps at a lighter weight or resistant that is more than sufficient. Workouts should not be any more than 45 minutes long. Anything more will be nothing but a waste of your time because you will be overtraining. Resistance training does not only aid in preventing injury or toning your body, it has many more benefits. Like I said earlier, it gives you a lightning speed metabolism. But let me explain to you what your metabolism really is, or what metabolism means. Metabolism is the process by which turning what you eat or drink into energy. During this process, the calories in the food and beverages are combined with oxygen to release the energy that your body needs to carry out the basic functions, otherwise known as your basic metabolic rate, aka your metabolism. Here are 3 factors that go into determining what goes into your metabolism. First, your body size and composition. Larger people or more muscular people burn more calories even at rest. Second, your sex. Men typically have much less body fat and more muscle tone than women of the same age and weight. Third, your age. As you get older, the amount of muscle tends to decrease, and the fat accounts for more of your weight, slowing down the calorie burning. Energy for your body's basic functions stay fairly constant and aren't easily changed. Your basal metabolic rate accounts for 70% of the daily calories you burn every day. As stated earlier, resistance training has a positive effect on your metabolism. Here are 3 parts of your metabolism. Your resting metabolic rate, RMR. RMR is the amount of energy required to maintain the bodily functions and processes by which when you are resting or awake. This accounts for 60% of your daily calorie needs. Second, your TEF, your thermetic effect of feeding. This is the amount of calories that you use to eat and digest food. This takes up about 10% of your caloric needs. Lastly, your TEA. TEA is known as thermetic effective activity. TEA is the rate by which you burn calories while exercising and with normal day-to-day movements. This accounts as 30% of your calorie needs. Now that I have explained to you and broken down what metabolism and all the different parts that go into your metabolism, let me tell you why resistance training and metabolism through resistance exercise, why resistance training and your metabolism go hand in hand. The most effective way to boost metabolism is through resistance exercises.
All right, let's go real quick.
Cardio and resistance provide a positive effect against a drop in metabolism. This is because people tend to lose a considerable amount of muscle in calorie reduction programs that do not include strength and resistance exercises, whereas one of the main benefits from an exercise in a weight loss program is the prevention of muscle. While you increase your muscle, you boost your RMR. RMR, resistance training, burns calories, raises metabolism, and builds muscle that will later on burn calories. According to a recent study by NASM, the National Academy of Sports Medicine, participants performed in a resistance training program for 6 months. After 6 months, participants had an increased RMR and burning an extra 100 calories a day. It is important that you look for situations to be active. You can take several 10 to 15 minute walks to increase your activity. To break things down even more, let's assume that you adopt the resistance training program and manage to increase your overall muscle strength by 5 pounds. This would take a significant amount of time and effort. And while it is certainly recommended and a worthy endeavor in respect to your overall health, from a purely metabolic rate and perspective, the end result would be that your RMR would increase by 5 pounds. Multiply that by 5 calories divided by your amount of pounds that you weigh times 1 day. This would equal 25 calories per day. Since there are 3,500 calories in 1 pound of fat, this means that your increased metabolism will allow you to burn an extra 25 calories per day. Multiply that per month. times 1 pound of fat would equal 3,500 calories. This equals 0.214 pounds of fat per month that you are burning just at rest. So to summarize, if you increase your muscle mass by 5 pounds, it'll increase your metabolism such that you are able to burn roughly an additional fifth of a pound per month. Resistance training is without a doubt the way to go if you want to improve your overall health.